The National Safety and Quality Health Service Standards came into force on the 1st of January 2013 and had been endorsed by the Health Ministers in September 2012. The purpose of those standards is to ensure there's consistent national-wide standards that health consumers can expect. In Queensland, there are service agreements between the Queensland Department of Health and each hospital and health service, and in these service agreements it mandates that hospitals must be accredited, so they all have to meet those 10 national standards. The intent of Standard 2 in the national standards is to create a health service that's responsive to patient care and consumer input and needs, and consumers can help clinicians to write health information that's meaningful to them. Some health services actually have a consumer on their board and/or their safety and quality committee, and this enables consumers to design care, guide the provision of a high standard of care, and guide the planning and introduction of new services and improve existing services.
The national standards, and in particular Standard 2, partnering with consumers, has really seen a marked increase in the amount of engagement between health services and consumers in co-designing health services. But we have to make sure that that's not the prime reason why it's being done. We need to make sure that the engagement is meaningful and has a direct impact on the outcomes for consumers. When we're talking about partnering with consumers and what good engagement looks like, we're not just talking about one kind of engagement. We talk about a whole range of mechanisms and using mechanisms that are most appropriate at the time. Sometimes consumers might just be involved in one-off focus groups, but there are also great benefits to be had from long-term relationships between consumers and health services that build trust, build knowledge of how the health system works, and create an understanding of what consumers truly want from health services.